Hello, welcome to Lurie Children's Ultrasound Department. This short video will explain everything you need to know for before, during, and after your child's ultrasound exam. After checking in and registering with the front desk, make yourself comfortable in our waiting room and help yourself to some fun activities. When we are ready for your exam, the sonographer will call out your name and escort you back to one of our exam rooms. If you brought a favorite stuffed animal, blanket, or toy from home, feel free to bring that back to the room as well. If possible, please limit the amount of family members joining your child in the exam room to 2, and make sure you do not leave any additional children unattended in the waiting room. Also, please silence and put away all cell phones, and remember that photos are not allowed to be taken during the exam. If you'd like images of your child's exam, the front desk will be happy to make you a CD of all of the images taken during the appointment. Once in the exam room, your child will get comfortable on the bed with you right by their side. If you would like the TV on, we have multiple kid-friendly channels to choose from. Let the sonographer know your child's favorite network, and we will get everything all set up for them. As soon as our hands are washed, it's almost time for the exam to begin. You will notice the lights dimming. This is to help the sonographer see all of the images nice and clear. There's no need to be scared though. If you would like them turned up after the exam, just ask and we'll gladly adjust the lighting once all the pictures are complete. Before any pictures are taken, we will ask for your child's name and birth date and any necessary background history that can add to the exam. If you have any questions or concerns, feel free to ask them now before the exam begins. This is the ideal time since during the exam, the sonographer will be looking, listening, and focusing on acquiring all of the required images. In order not to get any of the gel on clothes, and depending on the area to be imaged, we may ask for your assistance in undressing the patient or simply moving articles of clothing up or down a little. We always do our best to protect modesty and clothing with a towel as well. After applying some warm gel to the camera we will be using, it's time to start the exam. There's nothing to be scared of. You get to relax on the bed while we do all the work. The ultrasound machine uses sound waves similar to how a dolphin and a bat hears and sees things to take pictures of the inside of your body. The sound waves are sent from our camera through your body and back to the special computer. You can't feel anything on the inside, but where the camera is on the outside may tickle or you may feel some light pressure. The sonographer will very carefully capture all the necessary images that your doctor requested. All of our sonographers are board certified and have gone through extensive training to ensure the images of highest quality are obtained. Occasionally, a student or resident will accompany the sonographer in the room as well. Most of the images that will be taken will be still images, similar to that of a digital camera. The machine can also capture short video clips while scanning live as well. You may also see bright colors flashing on the screen and hear some crazy sounds. This is just showing where your blood is moving through your body and how fast it's going. In order to get the best views possible, the sonographer may ask you to turn on your side, hold your breath, or lay on your belly. If anything feels uncomfortable, just let us know. When the sonographer is done scanning, she will get you all cleaned up and send the images over to the hospital's online database. The radiologist will briefly look over all the images to ensure all of the required views are obtained and that no additional images are needed. Sometimes the radiologist may feel that an additional view may be needed for a direct comparison to a prior test. Make sure you don't get fully dressed or leave until the sonographer returns, just in case more pictures are needed. Don't be alarmed if the radiologist or resident stops in the room as well. Sometimes the radiologist can get a much better idea of your child's anatomy by watching the sonographer scan live. Occasionally, they may even scan as well. This just ensures that all questions are answered prior to your departure from the department. Once we are all complete, your child can get cleaned up and dressed. If you have another appointment, the sonographer will direct you either back to the medical imaging waiting room or to the floor your appointment is located. If you are all finished for the day, you are free to go home. The radiologist will then sit back down and carefully review each and every image and write up a detailed report that will get sent over to your doctor that ordered the exam. Your doctor will be the one to go over all the results with you, either over the phone or at your next appointment. Neither the sonographer nor the radiologist can give you the results of the exam. The ultrasound exam is just a small piece of your child's medical history puzzle. Your doctor will take all the information provided from the ultrasound and combine it with lab results, past medical history, symptoms, and any other pertinent information and go over all of this with you. Thank you for visiting us at Lurie Children's Ultrasound Department. It was our pleasure to scan you today, and we look forward to hearing your feedback.